Happy day to all. Welcome to Physiotherapy Competitive Exam Series. Contact details for license exam crash course are given in the description. Which of the following muscles contains the highest proportion of type 1 slow twitch fibers? A. Supraspinatus, B. Biceps brachialis, C. Biceps femoris, D. Gastrocnemius. The correct answer is A. Supraspinatus. We can call the supraspinatus either postural muscle or phasic muscle. That in turn indicates that it has the highest composition of type 1 slow twitch oxidative muscle fibers. It responds best to low weight and high repetition exercises. After suffering a traumatic brain injury, John presents with ataxia. How is ataxia best defined? A. Uncoordinated movement, B. Slow movement, C. Weakness on one side of the body, D. Lack of movement. The correct answer is A. Uncoordinated movement. Ataxia is best defined as uncoordinated movement. Slow movement is called bradykinesia. Weakness on one side of the body is called hemiplegia. Lack of movement is called as akinesia. A physical therapist is assessing a high school cricketer who is experiencing right shoulder pain during the deceleration phase of his bowling motion. Which muscle group should be strengthened to help decelerate the shoulder during the throw? A. Triceps, deltoid and latissimus dorsi. B. Supraspinatus, infraspinatus, subscapularis and teres minor. C. Deltoid and latissimus dorsi. D. Deltoid and pectoralis. The correct answer is B. Supraspinatus, infraspinatus, subscapularis and teres minor. This is because the rotator cuff muscles are responsible for decelerating the shoulder during the throw. That is, to bring down the shoulder, you need the rotator cuff muscles to work efficiently. So that is the correct answer. A physical therapist is evaluating a patient following coronary artery bypass surgery. The therapist notes that the patient's resting heart rate is 48 beats per minute with a regular rhythm. What term best describes this heart rate? A. Dysrhythmia, B. Tachycardia, C. Bradycardia, D. Normal heart rate. The correct answer is C. Bradycardia. Dysrhythmia cannot be considered because it is already mentioned in the question that it is with regular rhythm. Tachycardia cannot be considered because tachycardia is higher heart rate. Normal heart rate cannot be considered because we all know that the beats per minute is less. So it falls under bradycardia. I hope this video would have been useful. For more videos, stay tuned to our channel. Thank you.